get the hooky here. A major new medical study could result in millions more Americans being put on a cholesterol-lowering drug, even if they don't have high cholesterol. CNBC's pharmaceutical reporter Mike Huckman is here to explain why so many times we've just tried to tie even lowering bad cholesterol or raising good cholesterol. We've tried to tie that to fewer heart attacks and longer survival and good cardiac futures. Do we know for sure that even that works? Now we know even people that don't have high cholesterol might benefit?
Yes, we do, according to the New England Journal of Medicine.
Is this Crestor, or what is it?
Crestor. And experts think that this could prevent tens of thousands or hundreds of thousands of heart attacks in the U.S. a year, and as a side benefit, possibly help the bottom line of at least one major drug maker. HDL and LDL, or good and bad cholesterol, have become part of the American lexicon. Doctors say because of this new study, we should get ready for another cardiovascular-related abbreviation to become part of our vocabulary, hsCRP, which stands for high sensitivity C-reactive protein. A huge clinical trial involving AstraZeneca's potent cholesterol-fighting pill, Crestor, was done on people with low or normal cholesterol, but a high level of hsCRP. That protein, detected through a simple blood test, is believed to be a good predictor of heart attack risk. After less than 2 years on Crestor, patients saw their cholesterol and CRP levels drop significantly, and their risk of heart attack, stroke, bypass surgery, and artery opening procedures essentially cut in half. Harvard Medical School's Dr. Paul Ridker is the lead author of this study.
Now what we know is that a simple, inexpensive therapy, Crestor, can dramatically lower the risk of heart attack and stroke if you're in that elevated hsCRP group. And that's a huge win for patient care, because now we have an easy way to dramatically lower the risk of having these vascular events.
And that risk reduction is much bigger than Wall Street had been expecting. Experts think these results could prompt millions more Americans to be put on a cholesterol-lowering drug known as a statin. The question is whether it will be the more expensive Crestor, or in this healthcare cost-conscious environment, will it be a cheaper generic alternative? Cleveland Clinic cardiologist Dr. Steve Nissan is a key opinion leader.
It's a very large reduction in death, heart attack, stroke, and need for procedures like bypass surgery and angioplasty in a group of people that we otherwise would never have treated.
To find out what this could mean to sales of Crestor, tune in for a live First on CNBC interview with AstraZeneca CEO David Brennan later this morning at 11:30 Eastern Time on The Call. Harvard's Dr. Ridker has received grant money from AstraZeneca and other major drug makers, and he's one of the patent holders on CRP screening. Dr. Nissan says he directs any money that he gets from drug companies to charity. Quest Diagnostics says that screening for CRP in a standard blood test costs Medicare around $18 per test. For more, check out my blog, farmersmarket.cnbc.com. And you guys, Dr. Nissan, I don't know if you know this, has been mentioned as a possible head of the FDA under a President Obama. He told me last week that he likes his job, that he's amused by all this speculation, but that he has not sought the job, and he hasn't talked to anybody on the transition team yet.
But he didn't say no, he wouldn't do it
Correct.
either, right?
And this was last Thursday. This was only 2 days after the election.
We hear that a lot. I heard that the same answer. This is frustrating to me, Mike, because we know so little about what's going on here, really, when it comes right down. So high levels of cholesterol in the blood don't necessarily cause heart disease. It could
they do cause
now you're
heart
talking
disease.
about average levels of cholesterol in the blood somehow are contributing to heart disease as well, right?
No,
average
levels of cholesterol, but with a high level or elevated CRP. If you have over 2, these people in this study, I think, had something like a level of 4.
But the bottom line is it's not just cholesterol that you have to be watching.
Right, so when you go in for your blood test now, especially you, Joe, being over a certain age, you're going to say, not only check my HDL and LDL, make sure they put hsCRP in there as well.
Reactive
Why don't they just
cardiac
put statins in the water or something?
A lot of people have said that, and they are in the water, in fact.
Because that would be a communist plot, just like fluoride in the water.
Fluoride, yeah. Thanks, Mike.
You're welcome.